Telehealth and intimate partner violence, a systematic review of telehealth interventions. Intimate partner violence is a global public health problem and often leads to deleterious outcomes. IPV is associated with elevated psychological distress, impaired physical health, and high rates of morbidity and mortality. The COVID-19 pandemic in December 2019 has led to an exponential increase in the rates of IPV worldwide and has also heralded an increased use of telehealth to deliver medical and psychological services in the provision of healthcare. It is not yet known whether telehealth interventions are effective, and thus reviewing and synthesizing information on telehealth intervention, screening, and prevention for IPV is essential for our knowledge of the efficacy and future of telehealth in IPV. Our study conducted a systematic review of telehealth interventions for IPV with a focus on screening and intervention for IPV victimization and perpetration. The study applied PRISMA guidelines to a literature search that identified research evaluating telehealth and telemedicine interventions for DV and IPV. This was our inclusion criteria for the study. Our initial search yielded 1,296 articles with 713 remaining after removing duplicates. Only 14 studies met the study inclusion criteria, with 3 articles focused on telehealth screening for IPV and 11 articles studying telehealth interventions for IPV. Studies demonstrated heterogeneity in the purpose of the intervention, type of intervention delivered via telehealth, and intervention dosage, as well as the outcomes assessed. Results suggest that telehealth may be a viable option for the delivery of IPV screening and intervention programs, especially when face-to-face interaction is not feasible. The present findings highlight the growing utilization of telehealth modalities for IPV screening and intervention. Further research is needed to enhance the evidence base for telehealth screening, prevention, and intervention of IPV, and to evaluate the effectiveness of the approaches for individuals involved in IPV.